Okay, hi, it's Dr. Buford. We're just getting started on the right knee. We've already made what looks to be some real nice, hold the camera for a second, some real nice PRP from the blood that we drew. And now we're getting our first look inside the knee. Basically, we're running a lot of salt water through the knee, and we're using this little instrument. You can see it spins around, so it allows us to smooth out any rough areas, but it also has suction attached to it. And you can see how the picture starts to clear up a little bit as we start to flush out the knee. Sometimes just flushing out the knee can wash out a lot of inflammatory things and make it feel better. So everything that you see is magnified 30 or 40 times on the screen. And here you can see this medial meniscus. So far so good. The anterior horn here looks pretty good. Most remarkable thing here is that we can see some wear and tear changes on the articular surface here. See how this is an area on the femoral condyle that looks like it's a little bit loose. And so we don't want that to become a loose piece of cartilage. That feels pretty stable now. And as we look towards the posterior horn of this medial meniscus, other than a little bit of edge changes, the meniscus looks pretty good here. I think we're seeing all the way back to the table down just a little bit, please. We're seeing all the way back to the posterior horn there, and that looks pretty good. A little more, that's great. So I think we're going to keep looking here, but for the most part, the most significant finding here is this central area of cartilage loss. We would call that a grade 2 or maybe a grade 3 change. Okay, so this is the central part of the knee. This is the anterior cruciate ligament. It's running back up in the middle of the knee like it's supposed to. There's a little bit of a bony overgrowth on it here, but that's just the way you're built. Not a surgical problem. And now we're going to look in the lateral compartment. We'll go off on the video for just a minute as we pull out that lateral post. Okay, this is the lateral compartment. And very similar story, some very minimal radial fraying here along the posterior horn. But that really isn't that bad at all. Not the kind of tear that needs to be repaired. Some softening of the tibial plateau. You can see the cartilage here. I haven't seen any big loose pieces yet, so that's encouraging. There's the popliteus tendon back there. So running up towards 11 o'clock on the screen, that's the popliteus tendon. Now, we'll keep looking here, show you some more if we do any more surgery in this compartment. Okay, so now we're looking up at the patella and tracking this down into the area that you maybe have the most arthritis, which is right in the trochlea here. See this area here? So we're using our shaver here just to make sure there's nothing that's loose or about to be loose. But that certainly is a reason to have some pain in the front of the knee. And hopefully that's something that our PRP, and if need be, we can even do bone marrow concentrate. But those are our two orthobiologic injections that we typically use if somebody has symptoms from this kind of cartilage degeneration. That's a pretty good shot of it right there. Okay, so I think the last thing we're going to do is we'll make sure there's no loose pieces, and then we'll inject the PRP. So in terms of the video, the biter, in terms of the video, I think this will be the end of the video. I'm just going to put in a biter here just to see if there's anything that needs to be trimmed here. I don't think there is, but we'll just make sure. Kind of see how that goes. Okay, and then the last thing we'll do here is we'll put in our shaver again. Okay, so this will be the end of the video. Good luck to you now. Bye-bye.